Hi there, this is Bill Carew, and I'd like to welcome you to my first ever kitchen table chat on healthcare reform. Since we now have a law, no more bills or proposals, an actual law, I thought we'd start off here in my kitchen for a kitchen table chat on healthcare. Week 1. My focus today is going to be on the short term. What are the things that are going to take effect immediately or within the first 6 months of the law passing? And here they are. The first 3 things are good things for employers. Number 1, we're going to have a small business tax credit of 35%. So if you have less than 25 employees and you meet some income requirements, you'll be eligible for a 35% tax credit on the amount of premiums that you pay on behalf of your employees. You'll take it next year when you file the 2010 tax form, 1040 or whatever the equivalent is for your organization. So that's next April. You'll start to see the benefits of that. Secondly, we have a really big opportunity, I think, for a lot of employers who offer early retiree coverage. So if you allow somebody who retires from your organization to buy into your health plan, or you provide them benefits, if they're between the ages of 55 and 64, the government is going to reimburse you 80% of the cost for claims between $15,000 and $90,000. So if you're an insured plan and you work with an insurance carrier, then the insurance company is going to file and get that credit, and it'll be used to reduce your premiums next year. So that's good. And the third thing is, for seniors, the closing of the Medicare donut hole, at least a little bit. So Medicare D, the drug plan, says that if you reach $2,700 or so in claim costs, then you have a gap in coverage. You're going to get reimbursed $250 in the form of a rebate if you're a senior who approaches that actually enters that donut hole. $250 rebate for seniors. That also is good. Okay, so let me run through 3 things that employers are going to have to do to actually improve the levels of benefits for most employers, and it's going to cost a little bit of money. Those 3 things are, number 1, you need to allow access to dependents up to age 26, through age 26, that is. And it's not dependents in the form of students or dependents as determined by the IRS. It's dependents, married or otherwise, will be eligible to stay on your plan through age 26 if they don't have access to coverage on their own. That's going to cost a little bit. The second thing is doing away with annual limits for certain coverages. So most plans have caps on, say, physical therapy or occupational therapy or speech therapy, chiropractic, those sort of things. And by and large, annual limits are going to be prevented by the Secretary of Health and Human Services. Catherine Sebelius, who's in that position right now, will make a determination about which annual limits might be allowable to keep. But by and large, those annual limits are going to be prevented. And so she'll have something to say about the specific details of that. But there's going to have to be some changes for most group insurance plans. And the third thing is doing away with the lifetime limit. Most plans have $1 million or $2 million lifetime limit, and those have to be stripped out of the plan as well. Now, those last 3 provisions, the lifetime limit, the annual maximums, and the dependent eligibility through age 26, have to be in place within 6 months of when the bill was signed on that would be September 23rd, or plan years that start after September 23rd. So if it's an existing plan, as most employers are, that when your next renewal comes up, you'll have to make those changes. So there they are. Those are the short-term impacts on health reform. And as I said before, this is a hugely complex piece of legislation. And I certainly don't know all the details, and I don't know anybody who does, because to be perfectly honest with you, the rules have not been written for some of the details that are included in these plans. But we'll stay on top of it, and as time progresses, we'll learn more and more about how we're going to be implementing these things. If you're looking for a little more detailed understanding of these provisions in the bill as a whole, then join us on April 6th when we have our health reform workshop. You can access the information through our website or call our main number at 860-409-7200 and just tell the receptionist you want to sign up, and we'll make sure that you have a seat reserved for you. So thanks for joining me in my kitchen on this first ever healthcare reform kitchen table chat. Talk to you soon.